Hello.
Hello.
Oh, who's on the call?
Christina Pablo?
Oh, Christina. It's Debbie Dijak. How are you?
Good, how are you?
I am so glad you're on the call. Tell me you guys are going to come to Washington, D.C. Can you come?
I'm trying to get there. I forwarded it because there's a deadline of the 22nd for the room reservation.
Yep.
So I've been trying to push, and our administrator hasn't been here for almost a week and a half, so I'm just kind of sitting still.
Oh,
yeah.
Well, we might be able to get, I could, try to get an extension or work it out if I know you're pretty sure you're going to come, but I think there's usually a 24-hour cancellation. Could you just make it, and then if you needed to cancel it? Because sometimes that works.
Oh, okay.
I'm not sure. You know what I mean? Like, just book it and ask them. Say, if I canceled it 24 hours in advance, will I lose anything? Because you might just be able to do that.
Yeah. Okay.
And then you can always come and cancel it. You know what I mean? Just so you don't miss out. Yeah.
Okay.
It's a thought.
Yeah, and I sent all the information to our board of directors at the hospital. They were interested in attending as well, so I'm hoping that we can get some of them to go.
Wow, that's exciting. That's very cool. Yeah, that's very cool. That's awesome. Well, I'll definitely give you a chance to introduce yourself and talk about who you are and stuff. So yeah, we always want anyone that's new to the call. We always want them to have a chance to let us know who they are and that type of thing.
Oh, awesome.
So, yeah. We should have a decent attendance because there's so many things going on, hopefully a lot of people will call in.
Oh, good. Okay.
I'm hoping. You never know. Some days you think and then it turns out different. So.
Yeah.
I'm hoping this is going to be a good day because the first thing that happened to me is somebody put soda cans in our freezer, and I went to take them out of there, and it exploded all over me.
Oh, no.
So fortunately, I didn't get hurt, but so my whole outfit is full of soda.
Oh, my gosh.
Always delightful.
Yeah, our last couple of days here has been very eventful. The other night we had a CNA pass out on the way into the entrance and just ran into a tree, and then the activity aide choked on their dinner, so they had to do the Heimlich and have the ambulance come. So it was eventful.
Oh, jeez. Oh, my gosh. And that all happened right at the facility.
Yeah, right after another. So we thought the ambulance was coming in for the guy who was choking, and it went right across to the guy where he ran into the tree. So we were waiting for the other ambulance. It was crazy.
Oh, it all happened at the same time.
Yeah.
Well, how long does it take you for the ambulance to get there? Because you're closer to the hospital.
Yeah, about 5 minutes, because they're just down the road from us.
Yeah. That's nice, though. I was like,
yeah.
Right. I should just step away for a second.
Okay.
Okay. We're putting together a little notebook with all I've been reaching out to some of the senators that we want to try to meet with. So I've heard back from 3 of them, so that's good.
Hey, Debbie, this is Joseph.
Oh, hey, Joseph. I just sent an email to Kathy Correa, yeah. And so she's going to call me back later, she said.
Yeah, we're happy to have her as our COO. Hopefully this will help with our management of our organization.
Yeah.
So I'm hoping she might consider going to Washington. But with all her job duties, the fact that she's only been on for less than 2 months now, or about 2 months now, again, it might be too soon for Kathy.
Okay.
But you never know.
Yeah.
The other reason I wanted to speak up was I have to go into another meeting. I will be listening in, but I'm going to be I don't have much to say other than I did try and forward your email to some other parties, but didn't get a return from those people. They might have already set up their own meetings and are invited to that New Mexico meeting. You know, the ladies already from New Mexico, the group from New Mexico, might already have been invited to that meeting. So.
Okay, so that was my question, like, for you, was who, if you thought anyone that you could think of from New Mexico that would go to the breakfast meeting, or should I just try to schedule something at a slightly different time just for our group? Because right now we have 2 meetings. We have one on Wednesday at 1 p.m. That's with Senator Tester from Montana. And then I just heard back from Senator Murkowski's office. She's in Alaska, Lisa Murkowski. And they asked if we could meet. Oh, shoot. Hold on.
Okay.
Asked if we could meet. I think it was Tuesday afternoon. They asked if we could meet in their office Tuesday afternoon.
All right. Okay, thanks, Debbie. Like I said, thanks for that forwarded email, and we'll just see if anybody responds. Thank you.
Okay. I'm glad you're listening. That's good.
Hey, Debbie, it's Keith over at HSAG. How you doing?
Hey, Keith. Good. Thanks for calling in. I did get your email. I was just really busy with some stuff. So, yes, the answer is yes on the urinary tract infection question.
Cool, yeah, there's a whole day of training on it this week, so I think I'm a little bit better at it than I was before. So.
You know, I really wanted to log on yesterday, but I was just finishing some stuff, and I just never got a chance because I know they sent me the link to the live stream.
Right.
But that was approved a couple months back at our QAA meeting, so I think we're good on that. I just need to get the training and understand that a little better.
Sure.
But I did have a question for you that we can talk about after, because it's 12:02, on something that I need to report, and I want to make sure I do that correctly. So,
sure.
All right. Anybody else on the call?
Hey, Debbie, this is Jonathan.
Jonathan. Hey, Jonathan. How you doing?
Good. How are you?
Julie. Did you guys get what I just sent you on the PowerPoint that we updated on Tuesday? Were you able to get that? I just sent it a little bit ago.
Yes, I did receive it.
Okay, good. So if you want to change anything else, that's fine. And just put Rick, make sure we get his title as COO, not administrator.
Yep.
Okay, perfect.
There's also Emily Flagman, Ron Ross's daughter, on the line.
Yes. Hey, Emily, how are you?
Good.
So Ron will not be on the call. Is that correct?
That is correct. Yeah, he's out of town right now. I'm not sure if he's on the road or what he's doing, but I just thought I'd listen in for him.
That's very nice of you, and we're very happy that you're on the call.
Okay, thank you.
Can you spell, Emily, your last name for me again?
Plegman, Plageman.
Deman. Okay, perfect. All right. Okay, I'm just kind of jotting down who's here right now. I'm kind of typing as we go.
Hi, this is Teresa Holt.
Oh, hi, Teresa. How are you?
I'm good.
I'm trying to see if I can find a little template for that request. I didn't really have anything specific in mind at the time, but I'm sure I could find something.
Either way, I just thought if you had something, if it was something you'd done before, you might have an example.
I didn't want to get too formal. I mean, if we do a grant or something, then we'd probably have to get a little more formal, but I just wanted something to put in with the packet, so people could kind of see who's all connected here, just some kind of little statement. It doesn't need to take hours of work, so. I have Teresa, I have Christina Pablo, who's from the Caring House here in Arizona. Hey, Christina.
Hi.
Okay. And let's see, so I have Jonathan and Julie, Emily, Keith, Teresa, Christina. Anyone else?
Larissa's here from KI.
Okay. Oh, and Joseph Ray. Joseph's going to be listening in even though he's on another call. So just so you know.
No, I'm in a meeting.
Oh, you're in a meeting. Sorry. Okay, Larissa, here we go again. Spell your name for me one more time.
Did you want first or last?
This is the first name right now.
Larissa.
Okay, one R, one S.
Mm-hmm.
I said Lisa Heflin was Mellisa, and then she now is in a different area of Alaska. Now, Melissa Castaneda is now Mellissa. All these names, it's difficult. All right, anybody else on the call? I have Emily, Keith, Teresa, Christina, Jonathan, Julie, Joseph, Larissa. Anyone else? Okay. All right, well, we're going to go ahead and start. It's 12:06, so even though I have a feeling there'll be a few more people on, I hope, but at least we can get started. So I'm going to follow our standing agenda. If I can find where I put it, I just put it here somewhere. Hold on. And then we'll have a lot of good updates today, too. Here it is. Okay, so we did our attendance and new members. So we have Christina Pablo here. Christina, why don't you introduce yourself and tell us a little bit about yourself?
Hi, my name is Christina Pablo. I work here at the Caring House on the Hill River Indian Reservation. I started here in activities, went to medical records, became a certified CNA, worked on the floor, helped the director of nursing. I was the director of laundry and purchasing, and I am now the HIM coordinator. So I try to keep everybody here in the know, I guess, education-wise, seminars, conferences, and I found Debbie at a conference and am very grateful. She's a very good resource. So that's me.
Yeah, and Christina and her team, a couple other staff members actually came here too. Archie and she spent pretty much the whole day a couple of weeks ago, and we talked about dementia resources, and it was a really, really good meeting, I think. I really enjoyed their time here, so it worked out well. Emily, do you want to introduce yourself also briefly? I know a little bit about your dad's company. Or your company,
yeah.
Sure.
We're with Native American Health Management, and we just provide management and consulting services to Native facilities across the nation. Right now we have a couple that we're working with, and then I think a few are coming on board.
Okay. And Emily, are you coming to the annual meeting also?
No, I don't believe I am able to make that trip this year.
Okay. I know that Ron said that we would, Susan Poirier is coming, I believe, and there was someone else that I didn't quite catch it. Do you know who the other person is?
It possibly is Brandy. I'm not sure. Was it somebody else from our Oglala Sioux Lakota nursing home location
You know,
for the White River.
It might have been Brandy's the administrator at the White River, right?
Oh, yep.
It might have been, but could you just follow up and double check with your dad, because I'm trying to get a good attendance, make sure I'm clear on who's coming and who's not.
Yeah, definitely. I'll find that out.
Okay, that would be great. Super. Okay, very good. That's good to have everyone on the call. Is there anyone have any changes in contact information? Teresa, did we get that straightened out with KAI? You said some of your contact information on our current directory was not correct.
I haven't gone back and checked to see if it got changed, but someone actually called and reported to us that they tried to call us and that was the wrong number.
Okay.
I can go back and
if we got that straightened out, or
No, I don't think so.
okay. All right. That was a while ago. I think I had forwarded you Teresa's email that someone had said there. I think it was, Teresa, it's your phone and your fax weren't correct, right?
I think so, yeah. I'd have to go back and check the email.
Okay. So that's on our the directory that's published on the cms.gov website. That's the one that we use, but, sometimes there are changes to that. And so if I find something out, I pretty much let Hoffman and Associates know, like, right away. And Julie, you reached out to our IT person here, William, and kind of updated the email. Do you want to just mention what you did there with William?
Sorry, say that again, Debbie.
Just mention what you were working on with William on updating our website.
Sure. So at this point, the Unite Group has their own website on Weebly.com. And on that site, you can sign up to be part of the Unite Group. And that current group site is not necessarily linked with the email address. So I work with William to kind of synchronize those contact information from those that sign up to the group, which has to be approved by Debbie and William. And then they send me the information that they get through that portal, and I update the email list, which is then used to send out the newsletters and other updates to the group. And so we recently synchronized that list, and now we have an updated list. That's good. I think at this point we have about 70 people on the email list.
Is it that many? Okay, good. Yeah, I think I didn't actually count them, but I think you're about right. Okay. So that's pretty awesome, and that includes not just actual people working at tribal nursing homes, but that's some of our stakeholders too, like the QIOs and the GWEPs and things like that. So, and I did have outreach to Laguna Rainbow to Kathy Correa. Tammy Reed called me and said, could you reach out to her? I guess she's the COO, is what I'm hearing from. And I don't know, we may have a problem also, Julie, with Sally Hutton at Colville Care Center with her email, because that came back to me the last time I sent it.
Okay.
And also, we should probably take off Carly Clausen from the Shoshone and put on Ina. So I sent you the Ina Weed Hurley, her email. And then I'm hearing that there's a tribal nursing home on the Crow tribe in Montana. Does anyone know about that? Anyone familiar? Tammy was saying something about it. Anyone familiar with a tribal nursing home on the Crow tribe in Montana? Okay.
I don't, but I have a couple of contacts on the Crow tribe who work in their health, in their health clinics, so I could reach out and ask about it.
Yeah, see if you can find out or how it's licensed. I have a feeling it's probably not Medicare certified, but it sounded like at one point they had reached out to Morningstar. So maybe it was just they were in the process of trying to do something. I'm not really sure. So just until we get to our annual meeting next month, Tammy Reed has agreed to kind of co-chair or co-lead this group with me. So because of Melissa Heflin's absence, but at our annual meeting, that will need to be an agenda item where we'll need to think about leadership for this facility or for this this collaborative, so that we don't, so that the work can be spread out as much as possible. So, okay, that's good. Calls are being recorded. We did have, I'm going to go over just briefly on the minutes. We did have our June meetings on June 4th for a steering. It's usually the second Monday, but we did it the 4th because I was going to be out of town. And then we had our monthly call on the 21st of June, and we did have a steering committee meeting last month on July 9th. So I will just briefly kind of go over some of the high points of that. You all, Julie, did we send those minutes out? We sent it out with the newsletter, right?
Yeah, the July newsletter sent out the meeting minutes and the steering committee minutes from the June meetings.
June, excellent. So the way our monthly, for those of you who might be new, the way our monthly calendar works is we have our steering committee meeting the second Monday of every month, and we keep it at noon Arizona time. So it's either going to be 3 o'clock Eastern time or it's going to be 2 o'clock Eastern time, depending what time of the year we're looking at, because Arizona does not go on daylight savings time. Then we do the TTAG call. So I usually participate in the TTAG call, the Tribal Technical Advisory Group. That's always the second Tuesday. And then the third Thursday is when our monthly call is. And then the fourth Wednesday is when the Long-Term Support Service webinar is most months. And most of you know we are hosting the one coming up next week on July 25th. And we'll be talking about that in a little bit. So as far as the minutes, let's see. For July 21st, we had a really pretty full call. We had Sally Hutton from the Colville Tribal Convalescent Center in Washington was on the call. We had Melissa Castaneda, Anchorage Elder Abuse Consortium. So she's kind of taking over what Melissa Heflin was doing. We had Teresa Williams on the call, the administrator at Laguna Rainbow. Keith and Teresa were both on the call, which was great. And then we talked a little bit about resident rights, kind of some talk about the ombudsman. I'll give them a chance again today to do that. We did get the interviews done. We had some interviewing going on for our best practice report, so I'll let KAI kind of update on that. And I'd just like to stress that we talked about our goal is to get to know each other, to work together, and to strive for best practices. And I think that's a really worthwhile goal. I think at our meeting, we also may want to talk about some resolutions or things that we feel real strongly about that we might want to pursue for the coming year. The steering call was held on June 4th. Again, there were 5 people in attendance, and we got a summary of our webinar that we hosted on May 23rd with KAI. We also talked about topics that we want to bring up on next week on the LTSS July 25th webinar, which is about financial sustainability in nursing homes. We've had ongoing discussions about our annual meeting and who's going to be attending and presenting in Washington, D.C., and then confirming some of the meetings that we've been able to schedule with key senators on Capitol Hill while we're in Washington, D.C. And I do have an update on that today. Does anyone have any additions or corrections to the minutes that were sent out last week? Okay. All right. Hopefully you're all getting your emails from Kaufman Associates. Christina, if not, please let me know, and I'll make absolutely sure that you all get included on that, okay?
Yeah, I haven't received any.
Okay, so Julie, I think you actually requested that at one point, and maybe I just neglected to send that to you. But we need to make sure the folks at the Caring House get on the email list, okay?
Okay. Debbie, if you just want to, if I could just get that information once more, or just to make sure I have it. That'd be great.
So Julie, Christina, at the very end of the call, if you just hang on to the call when everyone else hangs up, we can go over that and give that to Julie. It'd probably be easier. And then we have no guest speaker today. Does anyone have any updates from NICOA, the National Indian Council on Aging? Anyone have any updates from Randella Blue House? We did have some correspondence from Dr. Blythe Winchester within the last month, and she was just asking if people could connect and get our newsletter, and we made that available to people. And there were some people she wanted to put us in touch with also, so we did have some correspondence. Any updates from NCAI? Joseph, I don't know if you can get back on the call for a minute or not. Joseph was at the mid-year meeting with the NCAI.
Only that the overall group, the National Council of American Indians, had reinforced their stance on the consultation regarding Medicaid and any changes regarding the work requirements. That was basically the big topic, and how our tribes were working with CMS. And that's the reason, again, I would like to have let this hear from, you sat in on the last part of the last TTAG meeting, correct, Debbie?
I did. There was a TTAG meeting on July 10th. Unfortunately, I logged on a little bit late. I missed some of it. But I did send you they're working on their next 5-year strategic plan for long-term support services, and so we have an opportunity to add to that. Very good. Yeah.
And again, one of the members of the TTAG is the president of the National Congress of American Indians, I think Lieutenant Governor Jefferson Keel from Chickasaw. And I believe, again, educating President Keel about our Unite group would again, help TTAG's understanding of where we're coming from.
Okay.
If I think of any other updates, I'll send it out to you, Debbie.
Okay.
But at this time, I don't believe. Just the next conference is going to be in Denver in October, in the third week of October, the annual conference. And at that time, if we would like to introduce the resolution, again, the staff there at NCAI is more than helpful for me, and probably would extend that to our group. So, and then my last update is regarding some of the poster presentations at the mid-year conference in Kansas City. There's major efforts regarding behavioral health and trauma that our elders are reporting earlier in their lives. So again, that was good to hear that there's, I think through the center in North Dakota.
The National Indigenous Elder Justice.
Correct.
Okay.
Mm-hmm. They're looking to bring those issues to light amongst the tribal leaders. So again, I think as long as our president says, dialogue is good. So there you go.
You know what? Thank you, Joseph. I really want to thank Joseph because he is very actively engaged with NCAI and other groups, and he's kept this collaborative very, he's doing a lot of work. And so he's right about that. I know CMS, those of us understand the 2019 regulations, when they come into effect next November, a lot of that is on trauma-informed care. And I'm participating in the Arizona Geriatric Society here in our state, and I will be actually chairing the conference in December, and it's all about trauma-informed care. So he's right. This is a really, really big issue, and not re-traumatizing people and understanding who they are, kind of looking at people as a whole person. So I think, thank you, Joseph. That's extremely timely. And I think the idea of a resolution that we may be able to work on at our annual meeting might be really timely too. So that's awesome. Anyone have any updates from National Indian Health Board? Anyone aware of anything there? Okay, the GWEP, so the Geriatric Workforce Enhancement Program, I have been in touch with them about our dinner meeting. They are they are able to give us $100 toward the cost of our annual meeting, or $1,000 like they have in the past. So we're working on that. And then I believe all those resources that are put out by the University of Arizona Department of Aging, those are being sent out to Kaufman and Associates, and then they put them in the newsletter. So make sure you check those links. So there's either the elder care provider sheets, which are more for the professionals, and then there's the care partner sheets, which you could print out and give to anyone, any of your residents, families, whatever. It's really good information. So hopefully everyone's tapping into that. Keith, you want to give us an update on HSAG?
Yeah, from a QIO program perspective, the major initiatives are still going. So we're focusing on antipsychotics and quality measure composite score. I was in Atlanta this week for the Centers for Disease Control and Prevention training on using their National Healthcare Safety Network on infection data. And so just kind of underscores this national movement towards more monitoring and surveillance of infection data. And they were particularly focused on C. diff because that's one of the projects the QIO program is working on. But they also had a full day around urinary tract infection. And they also talked about antibiotic stewardship and some of the other things like antibiotic resistance happening. So I definitely see those topics being major issues moving forward over the next couple of years. And I know there's a lot of talk, too. In early 2019, I believe CMS is going to be releasing a training for the infection control preventionists. That's going to be required by November. So definitely be on the lookout for that, because that's going to be a free training that can help get everybody set up. But the nice thing about NHSN is it's a free resource. I know, Debbie, you've been using it, and there's a lot of functionality with it that we're just starting to tap into right now, starting with C. diff, but it can do a lot of things like tracking your gown and glove use, tracking hand washing, tracking a ton of different infections that are out there. So again, using a program like this can also help align nursing homes with those regulations that are required now with infection prevention. And it's just good to do anyway, because without the data, you don't really know where you can improve on a lot of this stuff. So I really do see that being a big initiative and a big focus moving forward in the next few years.
Okay. Yeah, so you said there is going to be some mandatory training for nursing homes? I wasn't aware of that.
Well, the infection preventionist is going to be required by November of 2019. And so CMS, it's not a mandatory training, but they're going to have a training put together that skilled nursing homes can use to train up their ICPs. So that way they at least have something to say that they've used to train their ICPs for. So, the ICP is mandatory. Is the training mandatory? By default, I would say, yes, you'd want to make sure you do it.
Yeah. So that's kind of like when they put together the hand in hand, that big module for training with dementia. Would it be similar to that?
I don't know, because I haven't seen it. All I know is it's coming. And I know the American Healthcare Association currently has a training up on their website that does something similar. So you can get a jump on it now by doing that, or you can wait for the free training in early 2019 from CMS.
Okay. I believe you guys have training up on your website too, right? HSAG?
Not specific to the ICT. We have training around, what leadership can do to teach their staff about antibiotic resistance, stewardship, C. diff, and things of that nature. But we haven't designed anything specifically to meet the requirement of the ICT. I would focus on ACA when CMS releases it or anything like that.
Okay. APIC also, the Association for Professionals in Infection Control, I think I mentioned I went to their conference in June. And they have, it costs a little bit, like a couple $100, but you can do their online modules too. So, that's an option too. So it's good to know, though, that CMS is going to have something. That's good to know.
Yeah.
Okay, Great, good. So, good. Ombudsman Teresa, you want to give us an update and share anything you want to share?
So I think I just wanted to share a couple of things that we're working on in our office. It might not be what the Ombudsman is working on across the nation, but there's been a lot of information out recently about sexual assault in facilities. And so we are currently working with the sexual assault response teams in our state to remove some of the barriers for them to go into facilities. And at least my perspective is that we need to work with the residents. Licensing or facilities will do their investigation and seek after criminal prosecution. But I think the piece that gets missed is counseling and the whole victim issues. Quite often the resident doesn't get any counseling, isn't seen by the sexual assault response teams. And sometimes that's because they have dementia and sexual assault response teams aren't sure how to work with individuals with dementia. Sometimes staff feel like people with dementia might not need any counseling. But in fact, I spent about a year doing research, and there are different ways that sexual assault response teams can work with residents. So it's just the beginning of a project, but it's something to think about. And then the second piece is as emergency planning. And so we are working hopefully to be able to come up with at least some information for facilities. And we're focusing on resident readiness. So the suggestion from the National Emergency Preparedness Long-Term Care folks is that every resident have a to-go bag in their room, which would include, at least for Alaska, a sweater, a toothbrush, medical information, emergency contact information, some snacks that they like to eat that are easily kept in there, some water. And then attached to the bag are 3 tags. One tag would be for the residents, because sometimes in emergency, whether it's a hurricane or an earthquake, they are evacuated by emergency response personnel, but it may be that the staff, they take some people here and some people there, and the staff don't get everywhere, and people don't know who they are. And then the other one tag would be for their to-go kit, their emergency bag, and one piece would be for durable medical equipment. Okay. So just something to think about. We had a tsunami warning here in some of our communities as a result of an earthquake about 2 months ago. And we checked in with those facilities, and some of them did evacuations. And it's always interesting when you do an actual and not just a tabletop drill. And so just working on those kind of things, that's what we're doing.
That's incredibly good information. Thank you so much. And definitely keep us informed, because as we move into trauma-informed care, that what you're talking about with sexual assault is very, very timely. And we'd appreciate any, information that's produced as a result of that. I think that would be really helpful. Also, for those of you, we did that interviews and KAI, we did a best practice report on emergency preparedness. I'm not sure, Julie, if on that report, if this came up about having a bag, but I know that our assisted living manager here in Arizona had gone to ACA. I think it was ACA or Leading Age, and one of the speakers talked about exactly what you just said, Teresa, like having a little kind of duffel bag ready to go for each resident. Here at Archie, we ordered those they're called like MET tags, where you have them on the resident, but that's more like to say how acute they are, like an emergency responder could look at that to know like what their level of acuity is. I don't know if you're using those at all.
So this all was sort of spurred by, we had a facility, it wasn't a nursing facility, but we had a fire and 15 people were displaced. And unfortunately, the office of the facility was on the second floor, so all of the paperwork, the emergency paperwork that they had, was burnt. And so in the hours immediately after the fire, it was very difficult to find out who the family contacts were. And in fact ended up being a news story on the news before we were able to, the facility was able to contact all the families, which caused a significant problem. And then the second piece was we didn't have their diagnosis, their medications, which were also in the office that got burnt up, and contact information for the doctor to get the prescriptions refilled. And so it became very clear to us that we needed to work on this. So,
right, that's very timely. Good, thank you so much. Does anyone have any questions or anything for Teresa? Any comments or questions on that? Okay, any administrators on today's call or directors of nursing or board members? All right. All right, KAI, do you want to, Julie, you or Jonathan, want to give us an update, or Larissa?
Sorry, I put myself on mute. This is Julie. So the update as of right now, we just last sent out the Unite July newsletter. So at this time, we are seeking submissions for the August newsletter. And again, this can include, just as Teresa noted, recent changes in protocol or practice within your facility, or any local news, or even sharing local events that taken place in your community where, residents or elders had attended the event. Anything that you find worth sharing with other folks that are part of this group and other stakeholders. Any type of submission like that is very welcome. Deadlines for the...
Julie, I think that's going to be the September newsletter, right? That's due the first Wednesday in August, right? We already sent out
We sent out the July newsletter, so the next newsletter will be for August, and the deadline for content for the August newsletter will be August 1st.
Okay, that's right. Okay, never mind. That's right. I'm sorry.
Yep, and you can submit your content submissions directly to Debbie, and Debbie can forward those on to me, and then we will work to get those incorporated. And we are currently working on the final, or the next quarterly Unite report that is focused on disabilities within tribal nursing homes. And so that's something that we are continuing to work on, and so that is in progress for the time being. And then, just as I noted earlier in the call, we have updated the email list, and so that will be updated on a monthly basis, and anyone is welcome to join the email list to receive information regarding the Unite group, including the newsletter, and if there are other special notices that folks will need to know about.
Okay, and you want to talk briefly about the financial sustainability, the best practice report, and the webinar?
Yes, so the next CMS LTSS webinar, which is a monthly series. The webinar takes place the fourth Wednesday of every month at 2 p.m. Eastern Time. This is a standing series that has been ongoing for the past four plus years. There is an archive of all of the webinars on the CMS.gov LTSS Technical Assistance Center. So this month's LTSS webinar series is focused on the tribal nursing home financial sustainability topic. So for the last quarterly report that was submitted to CMS in June was about financial sustainability, where we, KI interviewed tribal nursing home administrators about how their approach to financial sustainability is. And so that report was recently approved by CMS, and so it's just undergoing final final elements in order for us to share the document on cms.gov, so that will be hosted there. The webinar will be focused on this topic, and we'll have the same folks that we interviewed on the webinar for a panel discussion, and so that will be on July 25th, and again, 2 p.m. Eastern Time.
Okay, thank you. I hope you all will get a chance to register and listen in. I think it's going to be Ron Ross will be one of the panelists, Val Crail, Tammy Reed, and Rick Richards, who's here at Archie, and then I will facilitate that webinar. So last time in May, we had a really, really good attendance across the country, so we're hoping we have that again. And hopefully, Julie, by next Wednesday, that report will be on cms.gov so we can reference it, huh? You think maybe?
And that's my hope. So for all federal documents, all agencies have to adhere to the 508 compliance, and so that can sometimes be a lengthy process depending on report length. But that's the goal, is to have it available to share at the time of the webinar. Yeah.
Okay. And we also had Leo Litsky, who is still part of this collaborative, create a document that's also going through 508 compliance right now, and hopefully we'll have that for next Wednesday too. So thank you all for the work, for everything you're doing for us. We appreciate it. So I'm going to skip ahead just a little. Yeah.
Debbie, this is Jonathan. I just wanted to let you know that the document is currently going through 508 compliance. So as soon as I get it back from our team, I will let you know.
Okay, excellent. That'd be really great. Okay, so I think
have one update.
Yep, go ahead. I'm sorry.
I found out something regarding NIHB. They're having a data symposium next week, so July 26th, here in Washington, D.C.
Okay, what is that again?
It's a data symposium.
Okay. And it's the National Indian Health Board, or?
Yes, that's correct.
Okay. Excellent. So July 26th, data symposium in Washington. Just a one day?
It's just a one day.
What would that be about?
I just know that it's all related to data as far as LTSS is concerned.
Okay. All right.
It's the American Indian Alaska Native Tribal Data Symposium.
Excellent. Okay.
And it comes the day after. It follows CMS TTAG.
Okay. Oh, yes. I knew that was, okay, that's next week too, right?
Yes. Okay. It's on
the 25th.
Mm-hmm.
All right. So TTAG is the 25th, the same day as our webinar, and then the symposium is the day after. So that's good to know. And Jonathan is in Washington, D.C., so he will actually be at our annual meeting when we meet in August. So that'll be really great. Thank you, Jonathan. Okay, so that's excellent information. Anyone, let's see, I want to move on to our annual meeting and give you guys some updates. So right now, as of today, get my list here. I'm just going to give you some updates, and then we need to talk about it. We're going to be doing a presentation at the Title VI conference. So our annual meeting is part of the Title VI Technical Conference, their annual 40th anniversary conference. And that's going to be at the Marquis Marriott in Washington, D.C., and it's going to be August 13th, 14th, 15th, and 16th. We're really hoping that a lot of people will come to that. Right now, Teotech, they work with Teotech. She told me I think there were over 300 people, 500 people, something like that. So it's a good-sized conference. So far, I have heard back from Ron Ross, and he's bringing one person that, Emily, I'm not sure who that is, and Susan Poirier. So Susan's at the new nursing home, right? Emily, she's at the Oglala-Sioux Lakota Nursing Home in Rushville, Nebraska. Is that correct?
Yes, that is correct.
Okay, and then possibly Brandy Moran, who's at the Rosebud Sioux Tribe in the White River Healthcare Center, and that's in White River, South Dakota. So if they both came, that would be really wonderful and awesome. Cynthia LeCount did say she would be there. I have not heard back from John Johns or Bruce Fink. Two, our COO, Rick Richards, will be attending, and also one of our social workers, Catrice Lucius. Tammy Reed is attending and bringing Ina, who is, I believe, the new social worker. I think she's social work. Dr. Jordan Lewis from Anchorage, Joseph Ray. I still need to reach out to Sally Hutton and Christina. We're super hoping people from Caring House will be there. I believe that Melissa Heflin is going to come as an honored guest, which is fine. Unfortunately, Dr. Winchester has another commitment, and Val Crail can't come, and Lisa Johnson from our QIO in Alaska, or Keith, who just spoke, will not be able to be there. So we're sad about that. But that's our kind of our list right now. And I'll be there. And then for our webinar on July 25th, again, it'll be Ron Ross, Tammy Reed, Rick Richards, and Val Crail, and then I will moderate that one. So hopefully you can all be on that. And then our presenters for Wednesday, August 15th. So at the Title VI conference, we are on the agenda to do a presentation about tribal nursing homes. We've talked about topics and what we want to present, but we still need to work out the actual PowerPoint and what we're going to say. So currently the presenters are Dr. Jordan Lewis, Ron Ross, myself, Tammy, Ina, and Joseph Ray. So we have, right now there's 6 of us, and we will need to meet probably next week because the PowerPoint has to be done in Teotech no later than, I believe it's August 2nd. And the deadline, Christina, what did you say the hotel deadline was to get a room?
The 22nd, July 22nd.
Yeah, so that's coming up. So if you haven't, made a decision yet, the time is now because partly we need to know for food preparation. So when we had our steering call on July 9th, we made a decision to do something just a little bit different rather than have a plated catered dinner because our funds are not unlimited. So Ron Ross and Native Health have very, very graciously agreed to add another $500. So with that money and the money from the GWEP, we've got about $2,000 to work with, okay? So we're looking at having a small reception. And again, I say small because when you have things at a hotel like this, it really is expensive because they tack on a lot of fees and charges and different things. So I've been working with the Marquis Marriott. We're looking at having certain Title VI staff come from 6 to 7, and we're going to do like a little get-to-know-you kind of thing. And then from 7 to 9 would be our scheduled meeting where we, talk about our resolutions and where we want to head for next year. We usually, in the past, we've had kind of a clinical topic and a non-clinical topic, and that seemed to have worked pretty well because then we kind of center our webinars and best practice reports around that. And that's actually worked pretty well for us, that we can do whatever the collaborative wants to do. I'm just, saying that's what we've done in the past. So there will be, like we're going to put together like a little book of resources. You'll get something to work from at that meeting. So that meeting is from 7 to 9. And the thought would be, when I talked to the Marriott Marquis, they said, well, what are you going to do to have food for that part of the meeting? And I'm kind of like, I don't know. So I wanted to see what you guys thought about they could get us some pizzas for like $15 each, which I thought was pretty reasonable. So if everyone's okay with that, I thought we could just, while we're meeting, they could bring us some pizza and we could just make it a little less formal. Anyone have any thoughts on that? Anyone have any thoughts on just having more like a kind of pizza as we go with the meeting? Everyone okay with that? Okay. Okay, well, I'm not hearing back anything, so I'm hoping there's no objection to that. We're working with Title VI to see which staff members they're asking us to just send like a kind of like a personal invitation to that person so that we don't, just invite everyone and have too many people and have a problem. So that's kind of the thought, is just to kind of focus in on possibly the directors. I think at our steering committee meeting, we talked about maybe focusing on the Title VI directors. So I'm just letting everyone know on that. And then I wanted to give an update on our meetings. So far, we have a meeting scheduled with Senator John Tester. John is from Montana, and that meeting's set up for 1 o'clock on Wednesday, August 15th. That's in the Hart Building, which is one of the Senate buildings near the Capitol. And then we have an invitation that we just got from Senator Lisa Murkowski from Alaska to meet Tuesday, the 14th. Now, again, that would mean, that we'd have to, miss part of the Title VI conference. But if everyone's okay, they suggested a meeting time of 1:30 that day. So I just wanted to make sure everyone was okay with that. Is everyone okay with that? Anyone from Alaska that's going to be there? Okay. All right. So I'm not hearing anything. Is anyone feel it's okay with that? They're asking for a meeting on Tuesday, August 14th at 2:30. Are we all okay with that meeting? Okay. And then we also heard back from Senator Tom Udall with New Mexico, and they are willing to meet with people from New Mexico for a breakfast meeting at either 8:30 or 9 on Wednesday, August 15th. So just letting you know about that. And then they would be able to meet with the rest of us later, but that breakfast meeting would just be for the folks from New Mexico. So if anyone's in New Mexico, we just need to kind of spread the word about that opportunity to talk about long-term support services and what we do as a group of tribal nursing homes. Any thoughts on that? Okay.
Debbie, this is Teresa. I'm not able to come because I don't have funding for that. But do you know if there's other Alaskans coming?
So the only one I know of at this point is Dr. Lewis, Jordan Lewis. So Val couldn't come. And if you talk to Val at all, Teresa?
Just sporadically.
Okay, because I've reached out to him. I need to see if Marcella Wilson, I think, is still the director of nursing, and there was some talk about her coming, but I just haven't heard back. I know that Agnes Wheatler said she could not come, and I don't think that Cheryl Hodges is there anymore, correct?
Right, yeah. So Bethel's in a bit of a turmoil. Nome has a director of nursing, a temporary director of nursing, but their CEO just left, so I don't know what's going on there. Barrow would be the other facility. Barrow has a living home.
I'm not sure. Which one is that?
I'll have to look up the name. I'll send you the contact info.
Okay, that's fine. I mean, at this point, I think it'd be great that we have this opportunity. I had Gerald at the Yukon Health Corporation. I have at Piana Care Center in Nome, I had Philip Hofstetter. Is he still there?
No, he left.
Okay. Is Gwen?
Gwen is still there. Gwen is sort of the new kind of the splash temporary person.
Okay, so maybe I'll reach out to her then. I don't know about Marcella, and then Gerald's not there. And so they don't have anyone for Gerald right now?
They have somebody acting, and I'm not sure. Oh, here, I do have it. Barbara Bigelow.
Okay, and then Elizabeth Lee is no longer there either, right?
No, Director of Nursing is Tamara Littman.
Tamara with the T?
Yeah. I can send you the contact info.
Okay, that's fine. I'm just jotting it down real quick. Okay, that's fine. So I can reach out to those people and just see, just say, hey, we have this meeting and we're having, and see if based on that they'd want to come. So I know our time's getting short. I wanted to mention we are going to have an exhibit booth. So if you're coming and you want your facility represented in any way, if you send me a brochure flyer, you can mail them directly to the Marriott Marquis. And under my name, I can get them. I will make sure they're handed out at the exhibit table. So we will have an exhibit table Tammy Reed also volunteered her graphic department to put together a front back with a collage of pictures and our tribal nursing home information that we'll take when we meet with the senators. And we thought we would also take our best practice report on financial sustainability when we meet with the senators. I also did get permission from our board here at Archie Hendricks to graphically produce more of our brochures since we're kind of low on those. So we'll probably be using the same brochure. We'll just, make copies. So it'll be the same brochure with our updated information. So anyone else? Anyone have any questions, comments? I know it's after 1, so I don't want to. Okay. So please spread the word. I really will probably need the RSVP definitely by the end of the month. So definitely by the 31st, I need to have a final list because I have to set up for the food, and that's their deadline too. So if you're going to come, it'd be awesome. It'd be great to the annual meeting. Just, we just need to wrap this up here in the next week or so. So, okay. Anybody else have any comments or thoughts or questions? All right. Thank you, everyone. Take care. Have a good week.
Thanks, Debbie.
All right. Bye-bye.